Healthcare organizations represent a large part of the overall U.S. economy, and there are a lot of different parts of the healthcare sector. So the answer to this question is not particularly simple, especially when you consider that national health expenditure in the United States accounts for about 18% of our gross domestic product. The industries related or directly related include providers, that would be your hospitals and clinics, pharmaceutical companies, insurance companies, and medical device manufacturers. Those are the most direct people who would be impacted by these narrative attacks. From my perspective, I come from the provider side, so providing care to individuals. And what I can say is that for care to be delivered to individuals, that is a locally based provision of services to the individual. So everything happens on a local level. If a narrative attack happens on Facebook or some other site, that can impact the overall reputation for a provider organization. But on the local level, the provider organization has the opportunity to communicate directly with their constituents without getting the noise of other narrative attacks or targeted attacks against that system getting in the way. It's important for all healthcare leaders to keep their eye on what's going on in the real world. What kind of noise is being made by individuals who may have been impacted by something bad in the industry or have some sort of misdirected or directed anger at the healthcare industry and want to create this narrative attack. I think use of these tools will help predict what is coming down the road, and it can also help identify potential acts of vandalism or violence that could be directed at an organization. So by using narrative threat intelligence, we can see what's coming and create action plans to address those. Typically, that we would start off with your marketing and communications department, who would spot those and then try to create a counter narrative to what they're seeing on the web. But it could also be passed on and shared with your physical safety department or your information technology department, so that we could further defend something that might be a result of the narrative attack. That's a challenge from a regulatory perspective. Section 230 of the 1996 Communications Decency Act states that these carriers who are providing this misinformation are not to be treated as the creator of that content. So essentially, Google or Comcast, whatever your carrier is, they are not responsible for what is posted by other people. Now, if Congress were to go and reform Section 230 of the Communications Decency Act, that might be a way to put a little bit more pressure on these platforms or these carriers in blocking and preventing narrative attacks from happening. Other than that, I think that healthcare entities should be focusing on the public level, getting information out through local media outlets to counter those narrative attacks.